Welcome back to Good Day. March is National Kidney Month.
And in honor of the month, we've invited back Kidneys for Communities, a nonprofit that helps both kidney recipients and donors, specifically first responders in need of kidneys. We want to welcome back CEO Atul Agnihotri with us. Thank you so much for being here on Good Day today.
Thank you for having me.
Well, let's start with what is Kidneys for Communities?
Well, when we started out our nonprofit 10 years ago, we studied the data pretty extensively on how people donate a kidney in the United States. As you know, there's 100,000 people waiting for a kidney transplant to save their lives. And, they'll wait 5 to 7 years, during which time majority of them will either die or be too sick to be transplanted. So when we started our nonprofit, we studied the data and found that 96% of the people donate to someone that they either know, are family with, or have some sort of an affinity with. We found this emotion to be the strongest amongst the communities. So we've been working with community organizations that serve these communities to spread the word of these patients, of the suffering within those communities, and and inspire people to step up and perhaps save a life by donating a kidney.
Sure.
Very cool. And tell us why this is so important, and also, just how common kidney disease.
Yeah. And I think I mentioned that about 100,000 people are waiting for a life-saving kidney. There is a severe shortage of organs in the country. There are two types of, kidneys. You can get kidneys from two types of donors. One is a deceased donor, meaning people who have signed up before they die that they would like to donate a kidney, and upon death, their organs are, donated to individuals needing a kidney. And the other is for living human beings to donate a kidney. God has given us two kidneys, and science has proven that one can live a healthy, uninterrupted life by donating a kidney. So, and I think it also should be said that while any kind of donation we are thankful to any kind of donor, living kidneys do tend to last longer and have better outcomes. CDC says that about 13 people die every day waiting for a kidney, so it's quite a crisis.
Yeah, I can understand that. 37 million people with kidney disease in the U.S., 10% of the population? That's pretty significant. Why does your nonprofit focus on first responders?
Well, we serve many communities. The two that we've been highlighting during this kidney month are the first responders and the children, or the pediatric patients. On the first responder side, by first responders, we mean law enforcement officers, firefighters, EMT techs. These guys run into the line of fire to save our lives. And we estimate about 10,000 first responders and their family members are in immediate need of a kidney to save their lives. And we are asking people for their act of kindness towards these brave individuals and to help donate a kidney and save their lives. We also know that there's about 1,000 pediatric patients around the country in need of a life-saving kidney. And these children need the healthiest of the healthiest kidney because they have a long life in front of them. So again, we share stories about these individuals around the country, encourage people to, pay attention to their plight and find it in their heart to donate a kidney and save their life and give them a bright future.
And Atul, tell us a little bit about how those watching can help Kidneys for Communities, and just, whether it's donating or bringing awareness to it. What do you recommend, and what are some of the tools?
I think certainly if you come across a story of someone looking for a kidney, please distribute it widely as you can, because the more people are aware of it, the more there's a likelihood that someone may find it in their heart for that story and may step up for an evaluation of a kidney donation. For anyone considering kidney donation, I would urge them to go to our website, www.kidneysforcommunities.org, and click on Become a Donor button. And once you click on the Become a Donor button, you're contacted by one of our ambassadors, who typically is a person who himself or herself has donated a kidney in their past. they've gone through this experience and they handhold the prospective donor throughout their journey, making sure they're fully educated, making sure that they've sort of understood what it takes and making a prudent decision. And of course, we honor confidentiality and a right of person to change their mind at any given time without any pressure.
Sure.
The other thing that these ambassadors would do is connect these prospective donors to all the different benefits that we have. By benefits, I mean a lot of financial benefits in terms of out-of-pocket costs for these donors for traveling to donate a kidney or for lodging, food, childcare, adult care, pet care, or even loss of wages in the process of donating a kidney. We will cover all those costs for these donors.
That's great. Well, it's interesting, especially because a lot of people only think about this every couple years, maybe when you renew your driver's license here in Michigan, whether you're going to check the box for being a donor, or I know on my tax form this year there was a question about that. But it's great to have a nonprofit out there that really can help spread the word as well. Atul, thank you so much for being here. We're going to share this interview over on our website, also at 9and10news.com, if people want to hear more all about it. Thanks for being with us today.
For helping us spread the word. I appreciate it.
Yeah, you bet.